Good evening, dear friends. This is about what is our role in avoidable blindness in our country. So, as a private practitioner, I started in a two-room clinic and then one OT and one OPD with a 20-chair OPD hall. And then I started my clinic, and then we have grown big now with 3 hospitals, 3 tertiary centers, and some 8 vision centers, and a very big outreach program also. So how we started and all that, I'll just express myself how I could do all this. And then what is our role in preventing this avoidable blindness? So the major causes of blindness, as you know, it's a cataract, 66.2%. And then when you see the cataract surgery, complications because of cataract surgery are 7.2%. So this is what the scenario in the management of cataract surgery in India. So the visual impairment and how it has been brought down from 5.3% to 2.5% in the last few years, but as the population is increasing, the numbers as such are been increasing from the past few years. And the presenting vision in better eye, when you see that the cataract, they are more, that is almost 62.8%. And then the other reasons are the myopia and of course the child myopia recently after the COVID. And then what are the reasons? There are no money for them to get the surgery done, and no time, and then no escort for them, the people to bring them to the main hospital. So how do we do that? So there are some few things which I thought 25 years back, and then I started my practice. So as a social responsibility, as a human being, I thought we need to do something to the community apart from the people coming to my private clinic. So it started as doing some eye camps in and around in villages where the neglected people are there from the family, or even they are not rich enough to get a surgery, cataract surgery done. In our state, the Telangana, the state government has done a very big project, the Kanti Velgu, wherein they have done a screening for 15 million people were tested, and 4 million glasses were given. And of course, they started with the cataract surgeries, but there was an incidence of end ophthalmitis, and they stopped the surgical, and then they started only giving glasses. And of course, a lot of people got benefited last 3 years back. And then again, this program started now from January 18th, we are starting again the program in our state. So I started with doing here and there camps, and then selecting the poor people, bringing them here. That was my first clinic in 93-2000. After that, this is the second one, and this is the new one which we moved into. And we got associated with the Operation Eyesight Universal, and that NGO, they started giving us the insight how to go to the camps, how to do this in a bigger way. So we started a concept called the Vision Center concept and the hospital-based community eye health checkup camps. So 2 concepts we started. One is the Vision Center, where we started vision centers where there is a need for the eye testing, where the patients have to travel for more than 80 to 100 kilometers to the city to get an eye examination. Those areas we selected, and then we started these vision centers with the optometrist. So what do we have there? We do the eye checkup, gross eye checkup, and the retinal diseases are being diagnosed with the fundus camera. Then with the help of teleophthalmology, the photographs are sent to the main hospital. Apart from that, we have a set of these community health workers who work in that area of the villages in and around, who selected for that vision centers. And then they treat not only that, but they do the health education, eye education, and also apart from that, the immunization program and all. We train them, and then they are being trained by the Operation Eyesight Universal, and that's what we do. And we have the patients coming in directly to the vision center, and then these community health workers go to the villages, have a eye checkup house to house, and then they pull them up for an eye camp, and then the eye camp group go there with the optometrist, with the counselor, go there, have a selection, and then do that screening program, and whoever is necessary, the basic glasses are being given there, and from there they are being driven to the vision center, and from there they are being picked up if there is any surgical intervention needed. And these are the 15 villages we have been declared avoidable blindness free villages, and 8 villages are on the pipeline. And then So this is how we do, like we select them to go around, and then on and on there will be 3 sets of screening. One is the optometrist health worker, then the optometrist, then the doctor, and finally the Vision 2020 they declared that as a blind free village. And then, so what is the next, like when you're coming back to the 7.2% of the blindness happening, so we thought why can't we train the young ophthalmologists who are coming down, who are passing out of the medical program. So what is it happening for these postgraduates who are coming in, the new postgraduates who are coming in, what is happening is not more than 50 or 100 surgeries they are doing in some of the hospitals, and they don't have any experience of how to go ahead and then do the basic cataract surgery with an IOL implantation. So we thought like, why can't we train these postgraduates who are coming in? So first our hospital is ready to do the DNB program, but we thought we don't want to do the DNB program, but we'll take the postdoctoral fellows and then train them in surgical skills. So that's how we started with a 1-month program. And even the Mainpal Academy of Health Education from the Mahed, they used to send the postgraduates to our place to Warangal all the way for a 1-month program, training program in SACS. But from there, we had an idea, then we procured a training, certified training by the Health University from our state, and our hospital is the only hospital to have that program, wherein we have 6 postdoctoral fellows who are getting trained in our hospital for a 1-year program. And apart from that, we have a short-term program, 1 or 2 months programs also happening in our hospital to train the consultants who are coming there and spending 1 or 2 months and then learning the latest techniques of phaco and secondary IOL implantation.
So if you can please
because we are in the American Academy of Ophthalmology, even the people from abroad also are coming and doing this training program. And because of this, I've been getting a lot of appreciations all over the world. And before I conclude, I request you all to join the family benefit scheme of All India Ophthalmic Society. Thank you very much.
Thank you, sir. Indeed, it was an enlightening talk and a very much time-needed talk, especially for the young ophthalmologist, to share their contribution towards the avoidable blindness in India. Can I request the panel to give their opinion, just a bottom line?
Well, it was really a very enlightening talk, and I think this is the need of the hour in a country like India, that we all should follow this kind of a program so that the health reaches to the poorest and to the people where they can't afford to come to the hospital, come to the doctor. So we need to go to them.